Hey everybody, I'm Tash,
And I'm Damo,
and we are so excited to bring you this week's episode of
the Barry Chronicles.
Damo. Who do we have with us this week?
This week we have Associate Professor Dr. Michael Heath, all the
Very
way
excited.
from Melbourne.
Very, very excited. Thank you so much for being with us, Dr. Michael.
Um, Thank you so much for joining us. We're really excited. We've seen you on Instagram and been following you, and it's really nice to just connect with so many different people that are looking after all of us that are living with overweight and obesity. So can you just talk us through a little bit about what you do?
No problem. First of all, Damo and Tash, thank you very much for having me on. I've been watching your mainly Instagram feeds, and I think it's fantastic information. And I feel very lucky that we're in a time where, as we were just talking about, partnerships between providers and our clients is much more the norm. And I think that really greatly improves the experience of people going through metabolic surgery, and also it helps people understand better and make a better decision about whether it's right for them or not. So thank you guys very much for putting all this effort in. So I'm a metabolic and upper GI surgeon, which is kind of a very common situation in Australia. I perform upper GI surgery for cancer, for hernias, but probably 80% of my work is metabolic surgery. I've been doing this as a consultant for about 15 years.
Yeah.
So as I started, I was just coming out of that gastric band time when, gastric band was so popular. That was not a big part of my practice. That's more because of my age than anything else. And currently do mainly sleeves and bypasses. I do quite a few bypasses compared to normal. So I'm sure you guys are well aware that sleeves are 80% of Australian procedures, but in our practice, it's about 50%. We sort of do quite a few more bypasses, get a lot of revisions from bands and other things.
Yeah.
So, slightly different case mix.
Do you find that revisions are becoming more common?
Yeah, I think so. And it's interesting, isn't it? I think we're sort of in a time where people are just starting to understand how challenging weight is as a problem.
Yeah, agreed.
And everyone sort of wants a situation where it's kind of set and forget, one step, you fix it and you get on with life and you never look back. But there's very few health conditions where it's that simple, you know.
Yeah, agreed.
And I had a client yesterday I was talking to who had a sleeve and had done really well, and I'd gone from I think 140 to 80, and then had some weight regain, and actually came to talk to me about something completely different. But then during the conversation, I could sort of tell they were getting a bit emotional and wanted to address kind of the weight regain thing, which was only a small amount of weight. But we had to go through the conversation about where, if someone has cancer, for example, and go through all the treatment, things are initially successful, but the cancer comes back, you don't feel bad about it, you don't blame yourself about it, no one sort of looks negatively about it, you just get on and try the next thing, and you move on to the next step, and you do the next thing. Or same with high blood pressure, or same with diabetes, the diabetes gets worse, well, you have to go into the next phase of treatment.
Yeah.
Unfortunately, as you guys probably sit there aware, the weight regain thing comes with this kind of pejorative attitude, I guess, of regain. It's a bad thing for me,
Yeah.
But I think we really are starting to understand that weight is so much more biologically driven, and some regain is going to be a very likely outcome for some people.
Yeah.
So we're now happier to do revision surgery in those people. We're also happy to offer them other support. So there's some really exciting stuff coming onto the market now, isn't there? With goes and all that sort of stuff. So there are options, and we certainly shouldn't consider weight regain as a failure. We certainly want to help those people, and revision might be part of that picture. So we are doing a few more revisions. The longer it's a day, no, but yes.
Yeah, no, I think it's important because, and even still, every day we see people that they say, "Oh, I've failed," or "I'm failing my surgery," and it's such an ingrained thing that so many of us have. And Tash and I have sort of been beating the drum more recently that, it's not a failure. It's just that particular treatment didn't work.
Yeah.
And we shouldn't be beating ourselves up. But also, I think people need to understand that there is a science behind this. And I loved it at the IFSO conference. One of the speakers, he said that obesity,
overweight and obesity is not rocket science.
It's much more complicated. And I was like, yeah, that's really. But yeah, so I guess you'd see a lot of people come through. How do you help them decide what surgery is going to be best?
Or what treatment?
Yeah, good question. So this is actually the most common question that even, when you do talk to the doctors, that they ask, there's so many options, how do you choose the right one? I mean, obviously, there's a good degree of nuance. Some clients really only want to have one procedure, and some surgeons, I guess, would have a strong preference towards a certain procedure. But I think trying to choose the right procedure for the right person really is really important to make sure that you get long-term happiness and success, or as much chance of that as possible. Yeah. For us, we know the data shows that the sleeve is probably the simplest, probably the safest, and probably the least likelihood of macronutrient problems, but it's also probably going to be a little bit less effective, especially as the BMI really starts to go.
Yep.
Now, there's heaps of data now and randomized trials comparing these treatments, but those things are rather broad and very difficult to apply to an individual.
Yeah.
You've got an individual in front of you. You've really got to understand what they want, what their goals are in terms of health, weight, mobility, or their life, eating, all that sort of stuff. What sort of risk they're willing to tolerate, and what it would look like for them if they were having weight regain. How much of a problem it would be, whether they would consider that a failure or just part of managing it from the following. So we try and understand that as best we can, take a pretty detailed history. We sort of certainly get people to come back more than one time to really think about things. And I strongly encourage people to get on forums like this and read about other people's lived experience. And then putting all that together, we try and come up with a solution that's more long-term focused than short-term focused.
Yeah.
We keep a lot of data, and as you know, Australia has a registry, and each hospital has a registry. Our practice also is pretty data-driven, and we have everyone anonymously in a surgical database, and we look at that very frequently to ensure our outcomes are where we want them to be. So whilst there are small differences in terms of safety, they're pretty small actually these days. So we're really focused on trying to get the best long-term result.
Yeah. And what's your favourite procedure, or do you have a favourite procedure?
Yeah, everyone's got a favourite. My favourite would be a ruin, I guess.
Yep.
But I guess, the important thing is it doesn't matter what my favourite is. You sort of do what you need to do. And
yeah, of course.
Yeah.
Of course, but
an athlete would have a favourite opposition to play every time, but you play what you play.
Yeah. I love my gastric bypass. I'm very, very happy with it. 6 years on.
Yeah.
100 kilos of loss maintained. I cannot complain at all. Even though there's been challenges and complications along the way, when you stay in touch with your team and they're great at what they do, then everything gets managed, and it's good. So yeah, I understand.
I'd love to know from you guys how the process was for choosing a procedure during your time, and what you think you could have done differently, or what the surgeon could have done differently to make it even better for you.
Yeah, well, for me, my surgery was just over 10 years ago, and I had the sleeve. I'd been to a weight loss clinic in Brisbane at the time, and they'd recommended, I think then it was an Omega loop, but for me, and I had back injury, so I was on Centrelink at the time, and there was no funding in Brisbane for publicly funded surgery. So I did the private health cover, and the only surgeon really in my area was general surgeon, and he was most comfortable doing a sleeve. And I sort of look back because I've had terrible reflux ever since, and lost a heap of teeth and gone through all that. And there've been times where I sort of wish that I had have had a bypass, but then as we've been learning more, you can still have reflux with a bypass, and it's not necessarily a cure-all. So I think I'm fairly happy with the fact that I had a sleeve. I lost about 110 kilos, and regained maybe 20, but I've been at the same weight for 7 years. So I think overall
I think that's flipping awesome.
pretty good with that.
Well done. And I've seen your photos on the socials. I think you're hard to describe anything other than a huge success.
Yeah. And
So would you have preferred more choice, or is there a way it could have been a more easy process for you?
Yeah, I think now with the amount of options there are, I think it's important for patients to understand their options. And I think we still have a lot of people that, they go to a surgeon and it's just, oh, well, I do this, I'm going to do a sleeve on you. And there are some times where we see it that they don't really understand why the surgeon has said, what particular procedure. And
ask all the questions.
And that's when I sort of say, ask the questions. Why is that what they do? And if you have trouble down the track, do they, offer a revision, or, are you just sort of left to work it out for yourself? And for me, when I had it, there weren't really any dietitians in my area. And so now, if the dietitian I went to was printing stuff off Google, and I was just like, well, I can do that at home, so I'll just go and do it myself. And now I see people that they're still not getting that aftercare with the dietitian and whatever else it is that they might need. And that, it kind of annoys me, because we know so much better now that it shouldn't just be all tied up. I tell people, don't go to a surgeon for your nutritional advice. They're a surgeon. That's what they're good at. They've mastered the art of a sleeve or whatever it is. But I've seen what some of the surgeons eat. Don't get nutritional advice from them.
Well, it's funny. You're sort of a product of your circumstance, aren't you? Maybe that kind of experience sort of forced you to learn about it. Maybe has that maybe been the kind of trigger to kind of bring you
that's why I really wanted to do the like run with the Facebook groups and the support network, because I know that there are still a lot of people in rural areas that don't have access, and it's getting worse with changes in Medicare. It's more expensive to do phone consults and all that sort of stuff. And people just can't afford it. And they've invested, some of them have invested everything that they have in getting the surgery, and they just don't have that extra money to pay for dietitians and psychologists. And I think if we can provide sort of just the direction to go in, like, is there a good website, or is there a good online program that they can do, and being able to connect with surgeons and those dietitians, and I think for those people it's making a real difference.
Well, I couldn't agree more. And I guess our model's always been to try and make that journey kind of as easy as possible.
Yes.
I always tell people it's kind of like learning to drive a car. Everyone sort of has an idea of how a car should be driven, but I can hand on heart assure you that if you tried to learn how to drive a car with no teaching, you'd probably learn. You'd probably ding it up a little bit on the way. If someone just shows you, it's so much easier, it's so much smoother, it's probably quicker, and you're probably going to be a better driver at the end as well.
Yeah.
It's it has always surprised me that there was sort of situations where you'd have a sleeve and then you'd be kind of your own good luck.
Yeah.
Yeah.
And it really affected me. I mean, I lost 50 kilos in my first 4 months. I didn't realize that a lot of that was muscle. I was just like, oh, the scales are going down. This is fantastic. And then suddenly, like, I really couldn't eat very much. I wasn't well, and I'd actually needed a dilation done. And then suddenly, I can eat again. And, like, I was still losing a lot of weight, but I could actually eat. And then my life wasn't, I wasn't sort of regretting the fact that I'd done it. And, so, and I think that would have been picked up sooner if I had have had a team. Dietitians that knew what they were doing and could say, hey, look, this isn't, you should be able to eat a bit more than 3 teaspoons of food when you're 4 months post-op. And so, yeah.
Well, I don't mean to take over your podcast, but it's actually quite uncommon that as a surgeon you get to speak to clients who've actually got so much knowledge in this space. We provide bariatric surgery in a private clinic, but also in the public hospital at St. Bees here in Melbourne. And one internal conflict we have is that the public hospital just cannot fund that support that we just intuitively do in the private. So the clients will have a much longer wait. They have surgery in the public and they can see the dietitian maybe once, maybe twice, best 3 times in that first year. That would be unusual.
Yeah.
And we wrestle with this idea. I mean, do you guys think that providing a public service, which is not quite the same as a private service, is that a good thing, a bad thing, or is it setting up people for failure? What are your thoughts on that?
I think it's a good thing. I think that there are people who are just so desperate and they desperately need help. They want to be able to live their life in a normal way. They don't want to be held back by their weight. And I think that that's where Bariatric Support Australia steps in. I think that's where online forums can step in. And while it's not a perfect solution, it's certainly not. And of course, there's always going to be information out there that maybe isn't quite as helpful. That's where we do have the opportunity to at least point people in a good direction. I think that, and one of the things that Damo and I are extremely passionate about is seeing a change in the amount of publicly funded bariatrics that are bariatric procedures that are being done in this country. I mean, the fact that it's only 2% nationwide are done in the public sector. I mean, I know our Melbourne public bariatric teams are faring much better than the national average, but living with overweight and obesity is an issue in our country, and it needs more funding. It just does.
It totally does. And it's such. I mean, if you're budgetary minded, it's such high return on investment. In terms of quality of life, employability. It's just
exactly like how much does it cost to support somebody that's living with diabetes for 30 years?
Yeah.
And how much does it cost to do a really safe procedure and give them a sleeve or a bypass and see them perhaps be able to be in remission? Like, my goodness. it just
That's why groups like this are so important, because it really helps break down the barriers with clients. And funnily enough, I think this kind of weight stigmatism is going to be broken down by the clients first, and it's going to feed down to the medical profession, you know, probably more so than the other way around.
Yeah, I mean, I was invited to speak at IFSO a couple of months ago, and you know, I still had sort of professionals saying, "Well, why are you here? You know, what do you have to tell us?" And I thought then, you know, there is still such a huge divide, even though, you know, in some areas we're getting closer to actually working together, you know, to better our population. But then there can be still such a huge divide, and I think I find that frustrating. You know, it's like, just if we listen to each other, you know, because there's always going to be people that are going to struggle paying for those services. And I don't think it's fair that people are cut out or cut off from accessing a life-saving procedure just because they can't afford private health cover and or, you know, whatever is being charged. And Tash and I become really passionate about that. And I mean, my wife she was crocheting blankets and stuff to sell so that we could raise the money for me to actually have the surgery.
But you'd been given what's tantamount to a death sentence by your endocrinologist, hadn't you?
Yeah, you know, she had said to me, I was on 350 units of insulin a day, and my HbA1c was still 14.5. Wow. And you know, I was sick, and we took out private health cover, and the surgeon that I had, you know, the gap was still unaffordable for someone who was on Centrelink. But my wife went, you know, we'll do it, and she started crocheting blankets, and I had other family members that they had garage sales, and you know, and I thought, so even that, I was privileged enough that I had people around me that could help do it.
But you know, that screams to me, you know, you're a guy who's obviously very intelligent. You and Tash have put together this huge community. You're clearly very driven. You can, in that circumstance, you know, in a quick time frame, generate a whole lot of money. You obviously can do what you want to do. And to me, that really screams, it's just evidence that this is a biological problem, you know. This emphasis on weight being a willpower thing. You got plenty of willpower, mate. You got a 70,000 member group.
Yeah. The willpower
story.
Willpower is and has never been the issue.
Yeah, I mean, if I could have lost the weight by not eating, I tried that. You know, I tried the intermittent fasting. I tried, you know, one meal a day. I tried one shake a day. You know, and always ended up, the moment it plateaued, and then I would start regaining, even though I was still doing the same thing. But it was always, oh, you must be doing something. It was always my fault. It was never the fact that, you know,
never
shapes
the fact that,
are not
90% of our family are bigger people.
Yeah.
You know, it was never that. And I guess I know what I went through, and I don't think it's right that other people are still going through what I went through 10 years later.
Well, I'm surprised. I mean, I've seen the comments on your pages and stuff, and the surgeons certainly I've spoken to have been very glowing in their feedback about you two guys. I'm surprised that at the IFSO conference people were sort of, I guess, slightly negative. That sort of feels a bit.
It was
sorry about that.
No. It was actually so inspiring to be in the room when Damo was sharing. He had his little Weight Watchers book from when he was 8 years old.
Oh. Right.
And we both went to Weight Watchers because our GP had been telling our mother, you need to do something with these children. They need to lose weight. And at our local, and Dame has recounted the story before, but at our local chapter, if you gained weight, you were put in something called the pig pen, and they would stand you in the middle of a circle, and you were oinked at by the other people in the group. We were the youngest to be in that environment. I was 10 and Dame was 8 years old, and we had adults oinking at us. So, hopefully,
And I was like,
we've come a
I
long
was
way
about
since
30
then.
kilos.
Yeah, so it's not like it was a dire or a terrible.
It's like
Anyway, so
lies.
hopefully we are coming, well, and we have come a long way, I think, with overweight and obesity and the stigma associated with it. But there's still a lot of work to do, and people that could even be listening that feel scared because they are in a bigger body and they feel frightened to even try, please know that there are wonderful doctors like Professor Michael and others that will treat you kindly.
Yeah, and I guess when you work in this industry, you become quite passionate about that, because I think in 2024, I think most people on average really rail and feel absolutely disgusted by any kind of discrimination.
I agree.
I think when we see it a lot, we become quite passionate about the thing. I mean, the number of people I've had in my office in tears about their weight story, it's unbelievable.
Yeah, that's right.
Yeah. And I think that's something that we hear so often. People are even scared to bring up the topic with their GP, let alone with a surgeon, because and some of them do have terrible interactions just with their GPs, and they won't refer them to a surgeon. So then when they finally get there and they're sitting fit, I think a lot of us would go in feeling like we had to justify why we were having it, as if the surgeon can't see why we need it. We would feel like we had to justify it. And, I don't see any other disease that, doctors will treat where patients have to justify why they should get treatment for it.
100%. Actually, I've got a box of tissues permanently on the desk. It's a charged issue.
Mm.
Yeah,
it really is.
I mean, you had that when you went to your surgeon, hey, and you started trying to justify.
I did. It was the very first thing that I did. I just jumped straight in and I started trying to justify all of the reasons why I needed surgery, and he was just amazing. It was so beautiful, and just said to me, nobody sits where you're sitting unless they've tried everything. It's okay. I'm going to help you. And with that, I just lost it in that situation. But do you think that in time we will see, I mean, I suppose we will in time, but what more can be done to change the stigma around the fact that overweight and obesity is and should be treated as a medical condition?
Well, I mean, I think everyone would agree that it's about awareness, wouldn't you say?
Yeah.
And when you can speak to 60,000 people at a time, that's a huge step forward. I think actually, as these developments with medications become more and more found, and on the back of that, an understanding of the processes that cause obesity becomes more, it's going to make it much more accepted, both in the health profession, but also through the clients, that there is something medical going on here. It's not just, behavior and attitude and all that sort of stuff. So in a way, Tash, I think we're kind of lucky that we're at a time where it's probably going to evolve that way. We just have to keep pushing it in the right direction.
Yeah.
We're probably at the time where things are going to become more appropriate, I think is probably the way to say it.
I mean, we understand that while it is an emotive issue for us, it also has to be data driven for it to make sense to policymakers.
Yeah. Yes, and I guess it's the balance of the two. It's going to make it most successful, isn't it? Having the right data and the right information and the right science, but also helping people understand it.
Yeah.
Probably the data is now getting a little bit old, that has without a doubt confirmed all this is just fact.
Yeah.
It's just really
which is
believe the message.
Which we all know, we all understand. I mean, I think of my husband's actually having sleeve surgery in December, and he's never really had any kind of a weight issue until he hit sort of his 30s and developed sleep apnea. And we just saw, we've just seen a progression, as you do with something that is a disease and it progresses. And, just watching, I suppose, somebody that had something develop a bit later on in life has been very interesting. And the way that it affects the day-to-day workings and living has been so profound. And it's made him feel quite isolated at times. He said, it's just so sad when your body's doing things that it never used to do, and you don't know why it's doing it.
Well, I think as we move to a better understanding, it's also going to be much more permissive to prevention. Because I think because so many people still think it's behavioural, we're so weak on prevention. We just think people should behave better. That have a problem. But as we move towards understanding the medicalisation of obesity, then that's going to open the door to really kind of, I guess, more aggressive prevention and environmental changes to try and stop people getting this problem in the first place.
It's exciting.
Yeah, I love it. Something else. Oh, that's fine. So you offer. You have a team of people that you work with to offer.
We have a fantastic team, and that's one of the joys of, I guess, being a metabolic surgeon. We have 3 dietitians here, 2 nurses, a psychologist, a GP, bariatrician. We've got 3 physicians, and it's absolutely inspiring to be able to work with a big team. We've got 6 admin staff, and everyone's an absolute delight to work with. In other areas of medicine and surgery, you often have a small team. It's nice to work on a bunch of people that you really like and respect.
Yeah.
The dietitians run things like there's a retreat coming up, which
yes, I saw that.
the second one. So
That's amazing. I love that.
Yeah, well, maybe I'll get them to talk to you about it. But I guess we've always focused on that first year, or first 18 months, trying to get through the immediate trials and tribulations. But maybe also there's a need to support people as they sort of get back into real life. Yeah,
there is.
So working with a team is such a better thing for clients, I think, but also a really inspiring and fun thing for health professionals.
Yeah, and I think that's so important. And I think we can, like as a patient, we can forget that at times as well. That the surgeon or the team that we're dealing with, they're real people doing something that they're passionate about. And I've come to realize, like I guess one of my prejudices used to be that they're medical professional, they're just in it for the money, and it's just not the case. And I think that means so much to me, knowing that these are real people that actually care about our results.
Well, I mean, these kind of changes are so inspiring. Like, obviously people come into medicine because they want to make a difference and make people's lives better. And there's not many operations you can do to improve someone's quality of life. For example, cancer for us, some of the operations are pushing, debilitating. You're trying to treat the cancer, but it's a big deal, the operation. the body's a little bit worse after the treatment than it was before. Whereas this sort of thing, people get better, they move better, they feel better, they live longer, they have better health. It's really, really inspiring.
Yeah. Love it.
Yes.
Dr. Michael, thank you so much for joining us today.
Absolutely.
We would love to do this again. But yeah, we really appreciate it.
Thanks, guys. I really appreciate the opportunity, and I love hearing your stories. And yeah, myself or any of our team would love to join you. And I just commend you on what you're doing to raise awareness and help other people with similar problems living in their bodies.
Thank you so much. I'll just hit pause. Done.
That was amazing. Thank you
Thanks, guys. Thank you so much. I'm really inspired by your stories, and I am really, really genuinely grateful that you raise awareness.